It is February 9th, 2021. I had my egg retrieval this morning and I went from... So on this video, this is a mashup of a lot of things only because I had a few clips of things. So here we'll talk about my emergency surgery, the medications I had to start taking, my transfer, and just a warning. I mean, to me, obviously it doesn't seem disgusting because it's my video and my stuff and I experienced it, but there are some pictures that might be a little gross to some people, so just a warning. I just have like IVs in my arm and like drainage bags, so if that grosses you out, then skip right over. But yeah, so that's what this video is about. So we started off a little bleak, but it has a lovely ending. So stick around so you can find out what that ending was. All right, hi friends. Hope everybody's all right. So the transfer. We were hopeful to do a fresh transfer, but unfortunately, I had to have surgery first in order to, up the chances of a successful transfer. So they found some polyps in my uterus. So that was removed. But while the surgeon was there, he saw that my right tube was all twisted and tangled and attached to my intestines. So that was removed. So recovery was okay, but unfortunately towards the end of April, beginning of May, I got really sick, resulting in an emergency surgery, which was an open myomectomy. And it turns out that I had a bacterial infection because of a ruptured cyst. It was crazy. I ended up in the hospital for 2 weeks. I had pneumonia. I had drainage tubes. It was hectic. It was scary. It was dark because I just wasn't sure what was going to happen now as far as my transfer was concerned. So we waited a few months. Recovery was long. Thank goodness for my friends who came and looked after me. And we were able to reschedule the whole transfer, which thank goodness could happen. And here you'll see this is one of the first scans I took to see how everything was looking in order to get started. So it's transfer time. Of course, I had to get a mountain of Lovenox because more new protocol means more hormones. And here's another look at our 5 embryos that are in the freezer waiting for the transfer or a transfer. New protocol means new medications, so I got a new setup. And here is a picture of the embryo we're transferring. However, you can't go without progesterone in oil. If you've done IVF before, you know this big scary needle is so needed. The day of the transfer, September 9th, I made myself a shirt. I was all excited, but oh, my nerves. My nerves were in my throat. I was so frightened, so frightened. But here's the facility. It was so calming. I did some acupuncture before, and I got fries after. So there's a superstition that if you get McDonald's fries, your embryo is gonna stick. So I did all the superstitions and all the everythings, and just some medications. Hey friends, welcome to the craft room and welcome to the mess. Ooh. Listen, it isn't a workspace. No, it isn't a craft space if it's not chaotic. Otherwise, what are you doing in that room? So I just thought I would hop on here for a bit of explanation, at least from my understanding. So my shirt, one of my friends asked me what is the shirt about, and I didn't realize that I didn't explain it to her. So I figured, yay, let's go around. Oh, now we're gonna get dizzy. I figured I would explain it to you guys. So on my shirt, you can see it has socks, fries, and a pineapple. So the socks, the clinic, the clinic that I went to, I don't know if this is a clinic thing or a personal thing, but the nurse would always encourage me to wear socks. She would always say, warm feet, warm, warm. Keep your feet warm all the time. No bare feet on bare floor, things like that. So the socks, that explains the socks. Then the fries. There's this idea that if you eat fries, specifically McDonald's fries, after a transfer, you are going to be pregnant. Your embryo is going to stick. McDonald's fries. I don't know what it is about the fries, but that's the idea. Then the pineapple. The pineapple has so many definitions or so many explanations. However, in the IVF world, when it comes to the pineapple, apparently if you eat the core of the pineapple, that's another thing that would help with the embryo sticking around and staying. How true it is, I don't know. But here's the thing though, when you going through this process, like you kind of like hold on to and cling on to any and everything. Like you look for encouragement, you look for hope, you look sometimes for things to distract your mind from what you're actually going through or what you're actually doing. So if it means, oh yeah, let me get every pineapple, everything, that's what you do. If it means getting large fries after every transfer, or even making a sweater, be getting fries after this or something like that, or like me making a shirt with my IVF survival kit, like that's what you do, because your mind is constantly running. You have all these thoughts all the time. You're worried because there's just so many moving parts to it. So like anything, I guess to bring you a little joy is what you do. And like I said, whether these things work or not, I don't know. I mean, I'm not a doctor, but hey, any opportunity to have fries, I'm gonna have fries. And you're so hungry after that. I don't know for other people, but for me, like, I was a wreck that morning. Like, we had to wake up at the crack of dawn to be there to do it, and we live an hour and a half away to get to Syracuse, and we were up so early, so I couldn't eat. But I had to drink water. You had to have a full bladder. So that's the only thing I was doing, is like drinking water. And clearly I didn't drink enough water, because when I got there and the nurse was like, oh, you need to drink more water. So that's what we had to do. But here's the thing though, is like, there's just so much going on with it and around it. So you're always looking for an opportunity just to entertain yourself, I suppose, throughout everything. But yeah, so there's a little explanation about the socks, the fries, and the pineapple. And so we're going to go back to the rest of the pictures, and I think I have a few clips as well, so I hope you enjoy. Whee! So you have the options to do acupuncture before and after the transfer, which I'm so glad I did.
It was so much better than the first time. The first time I was just like so anxious and so nervous, and I had a lot of feelings the first time.
Hey friends, I just wanted to send a quick message before the day ended, and this is Gavin. Say hi. Say hey, baby. So today is September 9th, 2022. Last year today, I got pregnant. Yes, I did. I got pregnant on September 9, 2021. I know some people are like, what? How do you know that? Or, oh, that's pretty accurate, or whatever you're thinking. But yes. So last year on this day, I did my transfer. Yes, I did my embryo transfer. And that was the first of our 5 embryos that we had. And that transfer resulted in this guy. And he's 3 months old today. Well, no, not today. He's three months old. He'll be 4 months on the 23rd, people. All right, forgive me. But yes, he's so special. And yeah, I just wanted to say that before the day ended. And he wanted to say hello too. So as it's PCOS month and just a little bit of encouragement, I know it's hard. I know it's challenging. It's frustrating. It's mentally, emotionally draining. It's all those things. And especially if your heart so desires to start a family, I know what it's like. I'm speaking from my personal experience. You know, I went through it too. I tried for many years. I tested for many years. I was on different medications and hormones and, you know, having endometriosis, PCOS, and no blocked tubes, no tubes, 2 ovaries, 1 ovary. You know, it's really difficult, but you know, it's easy for me now to say, you know, don't lose faith and be strong, because I had a successful transfer. You know, I had a successful round, but my success now didn't come with not struggling first. So just be strong, you know, just be strong about it. It will happen, and if it doesn't happen the way you want it to happen, there are other ways that it can happen. But I'm so forever grateful and so blessed to have not given up on myself and not given up on what my heart so desired. And you know, I had to have a lot of patience, and I had to give myself a lot of grace. So here's to our anniversary, oh Papa, for 1 year. I'm so grateful for this boy. Huh? Ah. He's such a blessing. You're such a blessing. Oh. Excuse me. All right, friends. We will chat. Chat another time. Bye-bye.
Right up here. Now watch. Woof. You see it?
Oh goodness, that
Oh,
was so
okay.
fast.
Now this comes out, and you can scoop that.
Go ahead, look up on that pillow. Thank you.
So, I'm in the bathroom. I just had my transfer. It was so fast. Like, he explained it, and he said, like, if you blink, you'll miss it. And he explained everything, which was amazing. But it was just so fast. Like, 1 minute he's talking about it, poof, poof, and it's like, poof, there it is. I'm like, oh my gosh. I'm pregnant. I am pregnant. It was so nice to have Blake there. Although he couldn't even be bothered, that guy. Like, he's just... Yeah, sure. It was so nice. Dr. Corley prayed with us. That was amazing. I appreciated that part. It was very nice. So, transfer done. No pregnancy tests. So the 2-week wait starts. All right. Hey friends, medication time, injection time. So I just opened this, and so I'm doing my progesterone in oil. Blake's been in the field. I've been doing it myself. It is not as bad as I thought it would be. I was having the worst anxiety about it, but what am I, like 3 days in, and it's been really, really good. It's been really good. So this is what I'm gonna draw with, and this is what I'm going to administer with. This is a 22. I've got my Lovenox right there. I've got to do that as well. So I've got my gauze, alcohol, my plaster, anything, some tissue that I think I might need. Hands are washed, and I've got my progesterone in oil. So I put this surgical tape over there because it the lid pops off. Alright, so we're going to clean that off. So as of Friday, what was Friday's date? The 10th. No, as of Thursday actually, my dosage increased from 1 milliliter to 1.5. So this is the needle I'm going to administer with. So I'm just going to go down to 1.5, or it's 1.5 right there, and then put the air in the bottle like that, and then we're going to get us 1.5 milliliters or cc's of progesterone in oil. So see, here we go. We're gonna fill this guy up. And it helps that you put a little in there. As you can see, it gives like that resistance, the pressure. Put in what they said, you put in what you're taking out. So we're taking out 1.5, we put in 1.5. It does take long. This is an oil. Like when you look at it though, you wouldn't think that it is. It seems to move pretty fluid, but it is an oil, and it is a bit thick, so it takes its time, but it'll get there. Let me see. Yep. There we go. Okay. Yep, on the head. Make sure you always put the cap back on. There we go, and then twist it off to change it out to be administered. Twist. There we go. You keep everything still in the cap until you're ready to use it. But I think you can get the gist of it. So that's the needle. It's a 22 gauge. This whole thing has to go in to the muscle. It's an intramuscular. Alright, so that's that for this one. I'm just going to clean up here, close this up, get my bearings to do this shot. Put this in my sharps container. Then I'll come back for the rest of this. I'm not going to show you my bum. No, not today. But that's it. So, look who is awake. Alright, so we have reached the end of this video. So hope you enjoyed. Hope it was informative. And I'm excited for the next couple videos that are gonna come up. But here's the thing, I said all of that and showed all of that to say this, that, you know, we have to be flexible. You know, it's really, really hard. It's really, really hard if you're one of those people who like plans and scheduled things and things to go according to this and have your checklist. Listen, throw that out the window, because I wasn't very fixated on a specific plan. There were things I would have liked to have happened, like my transfer earlier and not to have had another surgery, but it happened. It had to happen. So we have to be flexible. And that's the thing, because, you know, we started in 2018 with this clinic, but only were able to do a transfer in 2021, you know, and hello COVID, and things got canceled and pushed back, and I was one of those people who hadn't started medication, so I wasn't on the priority list, so I had to get pushed back. So be flexible, at least try to, because things happen, right, Baba? Give the friends a smile. Oh, there you go. Thank you. Thank you, Baba. I hope that gave you some encouragement and happiness and joy. Yeah. Say bye-bye. Say salani gase. Yeah. Whoa, big hugs.